My name is Dr. Adam Meyers. I am an interventional pain management specialist. I have been with Seaview Orthopedics for greater than 16 years. Grew up about 5 minutes from where I live, from where I sit. Went to Shore Regional High School and subsequently went to medical school. Yes, after graduating Shore Regional High School here in West Long Branch, I went to Monmouth University for a year, and that was followed by Rutgers University, where I graduated in 1990. I went to medical school in Kansas City, Missouri, University of Health Sciences College of Osteopathic Medicine. Graduated there in 1984, and then came back east here. Did an internship in Philadelphia, and then I did a residency in physical medicine and rehabilitation for 4 years at the University of Pennsylvania, and that was followed by a one-year fellowship in interventional spine pain medicine. Well, I'm a pain management specialist. I treat a variety of conditions. The field of pain medicine, there's guys who deal with medication management, there's cancer pain, there's guys like us who work in an orthopedic group here like this, and we do musculoskeletal injuries, sports injuries, and the vast majority of the patients that we'll see are patients with neck and back pain. And we perform both diagnostic as well as therapeutic procedures on these patients to help better diagnose their condition as well as treat it. Believe it or not, when I was growing up, I was never the best student. And my father kind of challenged me, I guess, when I was in college, and said, you know what, I'm gonna show him. So I kept doing pretty good, you know, a little bit better. And then he got sick. My father got sick, and he came down with this very rare brain disease. So now I couldn't let him down, right? So I kept going, and he started to fail quite a bit when I was in medical school, and subsequently passed, but he had this rare brain disease, and watching him die essentially right in front of us, and it was quite painful for him. So I think I went into medicine for him, and I went into pain management for him as well too. I was in my own practice for a very short period of time, for about 2 years actually. And things were going good, and I met Dr. Spagnola, one of the sports specialists here, at one of the dinners that one of the reps had. And he said, well, what are you doing? You know, being on your own is too much. Just join us, come with us. So I, looked into it and said, you know what? Probably not a bad idea. And it actually was a very good decision, now 16 years later. Rewarding, as with everything. You know, if you get a patient feeling better and they come back and their smiles and they're really feeling good, that's the best. That really is. And that means a lot to us. Hobbies and interests. Let's see, I'm married for 25 years. I have 3 kids, so I spend a lot of time with them. They're all active in sports. My daughter's 22, going to be 23 here in another month or 2. I've got a freshman at the University of Miami. My son Jack is 19. And then Luke is a sophomore at Red Bank Catholic High School. And they're all in sports, and they all keep me going. I'm very active. I'm a gym rat. I'm a runner. That's kind of a lot of my free time and my hobbies as well. You know, I think my personality is very good for what it is that I do. I'm very sympathetic, I'm very compassionate. I'm not your typical doctor, as you can see here. I don't wear the white coat or the cinched tie. It's a much more relaxed atmosphere, and I think patients kind of like that. And I think I can certainly, hopefully help. If anything, I can do my best, and I think That's all that a patient can ask for, is a doctor giving them their best.